Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. School-based feeding program ating pagtibayin. Wastong pagkain ating ihahain, mga batang kulang sa timbang. Ating pakakainin ng Go, Grow, and Glow. Adolescent reproductive health ay gawing gabay at patnubay ng batang mausisa ay di maranasan. Ang early pregnancy ay maiiwasan. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo sumama. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. National Drug Education Program or NDEP kung tawagin. Ito'y paigtingin, mga bisyo'y alisin. Sigarilyo at droga ay dapat nang buksain. Water sanitation and hygiene in schools ating kompletuhin, 3 stars ay abutin. Malinis na tubig, segregated na toilet, group hand washing at may napkin na rin. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo sumama. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Medical, dental, and nursing services na atin ding binibigay upang matugunan problema ang pangkalusugan ng mga guro at kabataan. School mental health program, kamalayan ito'y bigyang diin. Isipang malusog para sa akin at sa'yo, kabataan at guro, tara usap tayo. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo sumama. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin sa DepEd. Okay talaga sa DepEd.
Dear God, kayo po ang pinaka-understanding and pinaka-powerful. Kami po ay nagpapasalamat sa buhay pong binigay niyo po sa amin. Ngayon po ay nagsasama-sama ang mga taong different ang religions. Pero po sincerely po kami nagdadasal upang kami po ay maging united para makuha po namin ang aming goal. Gawin mo po kaming instrument ng love, light, and peace. Gabayan niyo po kami para po masundan namin ang inyong daan sa isang peaceful community at maging source ng happiness and hope sa isa't isa. Wish ko lang po maging nice ang place na ito sa lahat ng tao. Sa inyong kalooban at paggabay, sana po maging tulong ang activity na ito para mag-benefit ng marami. Gawin mo pong ligtas at malayo sa anumang sakit ang bawat isa sa amin. Kasi po scary po ang pandemic. Marami pong salamat, God, at mahal po namin kayo. Amen.
Isang malusog na Sabado sa ating lahat. Ngayong hapon ay ipagdiriwang natin ang pagtatapos ng One Health Week. Ayan! Kamusta ka naman, Nurse Shai? Months na, malamig ang panahon. At ika nga nila ay bedweather na. For sure, Nurse Shai, ay mas mapresko dyan sa inyong lugar at talagang malamig ang panahon. Tama ba ako, Nurse Shai?
Mabuti naman ako, Miss Chin, at maayos ang lahat. At tama po kayo, maraming ang puno dito sa aming lugar. At talaga namang malamig na ang panahon, kaya't feel na ang Christmas season. Madalas foggy na nga dito at talagang kung pwede nga lang masarap i-extend ang tulog.
Tama ka dyan, Nurse Shai. Alam mo dito sa NCR, minsan malamig na rin yung panahon dahil nga bare months na. And may mga umaga talaga na pagigising tayo, Nurse Shai. Talagang malamig pa, tsaka ang hirap pang gumising. Kung pwede lang talaga, kaya agree ako dyan.
Talagang nakaka-good vibes nga naman ang mga pangyayaring tulad po nito, no? Despite na mayroong pandemic, ay marami pa ring simple joys na napapansin natin sa ating paligid. At ayan, again, magandang hapon po sa ating lahat. Bago tayo magsimula, magpapakilala muna kami ng aking partner. Kasama ko po ngayong hapon ay si Miss Christine Isabel Buenvenida from the shoe capital of the Philippines, Marikina City ng DepEd Central Office.
Wow naman, Nurse Shai. Maraming salamat sa magandang pagpapakilala mo sa akin. Grabe, Nurse Shai, para tayong nasa pageant. Pero syempre, hindi naman din ako padadaig sa'yo. Introduce na rin kita, partner. Kaya mga kaibigan, kasama ko po ngayong hapon ang isa sa ating mga back to school champion, Nurse Claire Shenamay Oyog from the Land of Beauty and Bounty, the Land of Beauty and Bounty, Lanao del Norte ng District of Magsaysay.
At kami ang makakasama nyo ngayong hapong ito.
Ayan, simulan na natin, Nurse Shai, ha? Ang tema ng One Health Week ay bayanihan para sa kalusugan. Okay sa DepEd, sa paaralan at sa tahanan. Ang buong isang linggo ay naging makabuluhan para sa ating lahat. Bagamat marami po tayong mga naging challenges na na-encounter, pati na rin po sa naging virtual conduct po ng ating mga activities sa buong isang linggo. Finally, partner, andito na tayo sa pagtatapos ng celebration na masasabi talaga natin na isang big and successful event.
Yes, partner. Nagtapos man ang One Health Week celebration, ito ay hudyat naman ng isang magandang simula para ipagpatuloy sa tahanan ang mga magagandang practices upang mapanatili ang maayos na kalusugan ng mga mag-aaral para na din handa sila sa pagbabalik eskwela.
Yan, partner, talagang tama yung sinabi mo na ang ating mga ginagawang ito ay talagang preparation para sa pagbabalik eskwela. Talaga namang naging matagumpay ang One Health Week celebration natin, partner. Dahil na rin yan po, siyempre, sa pagtutulungan ng lahat ng ating mga school health personnel sa pangunguna ng Office of the Undersecretary for Administration, katuwang po ang Bureau of Learner Support Services or ang BLSS School Health Division. Sabi natin, okay sa DepEd, sa paaralan at sa tahanan. And it seems, partner, no, na okay talaga sa DepEd. Naitanong mo ba, Nurse Shai, sino naman kaya sa BLSS ang talagang may say kapag kalusugan na ang pinag-uusapan?
Oo naman, Miss Jean. Ang School Health Division yan. Yes, ang School Health Division o SHD ang nanguna sa uplan kalusugan sa DepEd na nag-strengthen ng 6th flagship program. Ito ay kinabibilangan ng medical dental nursing services, kasama ang school dental healthcare program na naglalayong magkaroon ng mga clinics sa ang mga piling paaralan.
At syempre, kabilang din po ang school-based feeding program.
Nandyan din ang Wash and School program,
ang Adolescent Reproductive Health Program,
ang National Drug Education Program,
at syempre ang School Mental Health Program.
At hindi lang yan, madami pang ibang health-related programs ang SHD. Here comes the pandemic at muling nasubok ang kakayahan ng SHD to manage and handle the situation. Our health personnel from all level of governance worked hand in hand to better serve the learners in any given circumstances.
Tama ka dyan, partner. At talaga namang nag-exert sila ng effort at ginawa nila yung best nila para naman mabigyan ang ating mga learners ng quality health services. And at this point, partner, to discuss the overview of the BLSS School Health Division and to share to us the programs, activities, and projects, as well as the plans and directions on Okay sa DepEd program, to reach the learners saan mang sulok ng Pilipinas amidst the pandemic, let us all welcome the Chief of the School Health Division, Dr. Maria Corazon C. Dumlao.
Good day, everyone. I'll be presenting the School Health Division updates and ways forward. The School Health Division is one of the divisions under the Bureau of Learner Support Services, tasked to formulate the national framework for learner support services and develop policies and standards of programs and projects for the holistic development of learners aligned with the K-12 curriculum. And the School Health Division is mandated to come up with activities for the improvement of learner readiness in terms of physical health and proper nourishment. We are mandated to guide and capacitate education supervisors, administrators, health personnel, teachers, and related offices to effectively implement the school health programs and projects. And here are our key result areas: formulation of policies and standards, health and nutrition service delivery management, development of school health and nutrition education and promotion materials, and conduct of other IEC activities, capacity building for school health and nutrition personnel and program coordinators, procurement of health and nutrition materials and supplies, development and or refurbishment of health-related facilities, monitoring, research, and evaluation of school health and nutrition. And we implement the Oplan Kalusugan sa DepEd, or the Okay sa DepEd. And we will continue to strengthen the 6 flagship programs under the OKD. We have the school-based feeding program. We have the medical, dental, school dental healthcare program and nursing services, the water, sanitation, and hygiene in schools program, the adolescent reproductive health, the national drug education program with comprehensive tobacco control, and the school mental health program. So these 6 flagship programs are converged and they're implemented through the OKD. Okay sa DepEd is the convergence of DepEd's health programs, policies, and activities geared towards their effective and efficient implementation at the school level. And we are celebrating the week-long school-based celebration that aims to promote the importance of health and nutrition services in achieving the learner's full educational potential and supporting personnel's productivity. We also oriented the field on the Okay sa DepEd school calendar, and it's integrated in the Brigada Eskwela. There are activities that strengthen its assessment, resource mobilization and enlistment of partners, and community mobilization for the preparation of areas for medical and dental examination, refurbishment, facelifting, repair of feeding centers, canteens, school clinics, waste facilities, among others, water testing, establishment of nurseries and school gardens, setting up of signages, and capacity building activities. So every month, we celebrate different programs and activities for school health and nutrition. There are activities and services across the life course, and in the Department of Education, we highlight the role of DepEd in the curriculum integration as well as in the provision of support services. So we have a specific target, and we have also specific activities for the different age group. For childhood, that's 5 to 9 years old, we provide nutritious food products and milk to selected learners from kinder to grade 6. We conduct vision screening for kinder, grade 1, and also provide measles, rubella, TD for grade 1, distribution of hygiene kits, application of fluoride varnish, medical dental nursing service provision, mental health services provision, and we also have partnerships for school health. Now for the elementary, we also provide SBFP to targeted beneficiaries, also vision screening for grade 4, MRTD for grade 7, HPV for grade 4 female learners. We also distribute hygiene kits, provide mental health services, medical dental nursing services, and partnerships for school health. Now for adolescents aged 10 to 19 years old, we are implementing the Barkada Contra Droga chapters in high school, and the coordination is already transferred to YFD, but SHD continues to lead in terms of technical assistance in drug prevention through the National Drug Education Program. And there's also partnerships for the establishment of teen hubs. We also conduct vision screening for grade 7, 10, and color vision testing for grade 10, weekly iron folic acid supplementation for grade 7 to 10 and all female learners. We also have partnerships for the CSE, ARH convergence, and other school health services, and also the mental health services provision. For senior high schools, we have WIFA, supplementation for grades 11 to 12, health services, and partnerships for school health and other health services. For our 2021 programs, projects, and activities, we have some of our 2021 PPAs for the medical dental nursing services. It includes coordination, information dissemination, capacity building, and monitoring activities for COVID-19 response, including participation in the vaccination program, activities related to the establishment of DepEd Health Referral Network, and the conduct of consultative workshop for the development of the comprehensive policy on medical and nursing services. We also have the school-based feeding program, SBFP implementation for SY 2021-2022, PIR on SBFP and on the integrated school nutrition model. For the WASH in schools, we have capacity building activities, IEC materials development in the context of COVID-19, Seal of Excellence Award, activities related to the WINS online monitoring system. And for the adolescent reproductive health, we have strategic planning and policy development, training for rapid health assessment, adolescent health series part 2, and then activities for learners. We have the National Drug Education Program that includes capacity building activities for program implementers, campaigns, and examples are the advocacy for smoking prevention, the National No Smoking Month celebration, among others. We also have school mental health that includes policy development, school mental health forum, and capacity building activities. For the COVID-19 response and vaccination, it's worth mentioning that there's the creation of the DepEd Task Force COVID-19 with the BLSS School Health Division as secretariat. And there was also the activation and establishment of DRRM teams in the field with school health and nutrition personnel as lead. And then we have regular issuance of DTFC memoranda and aid memoir on matters related to COVID-19 response, including vaccination. The DTFC 19 Memo number 9 updated protocols in handling, managing, and testing of reported COVID-19 cases and close contacts at the central office. And it was issued as a reference of field offices in developing their own protocols considering their unique context. And we also have regular reporting of COVID-19 cases. In April 2020, the DOH issued DOH AO 2020-0015, which sets the minimum public health standards in various settings, including schools. And as we always rely on the directions and guidelines of the DOH, this became the primary basis for our DepEd Order number 14 series of 2020, which set the standards for DepEd workplaces and schools. In November, the DOH issued DM 2020-0512, which affirmed DOH AO 0015, DepEd's basis for its required standards as the policy reference for the minimum public health standards. Therefore, technically, the O14 series of 2020 remains as our main reference for the required health standards in DepEd. However, we shall take note that the DOH is currently finalizing a new issuance on the health standards, particularly the omnibus guidelines on the minimum public health standards for the safe reopening of the economy. Moreover, the Philippine Society of Microbiology and Infectious Diseases, in coordination with the DOH, also regularly provides updates on the health standards based on the most recent available evidence. For instance, they have recommended against the use of foot baths, even if this is currently required under DO14 series of 2020 and the DOH AO 2020-0015. To address this, and while we wait for the necessary amendment of DO14, which will also depend on the DOH omnibus guidelines that are yet to be issued, the DTFC issued Memo number 468 titled Reiteration of Corresponding Work-Related Guidelines for Community Quarantine Classification and Ensuring Observance of Strict Health Measures in Work Settings in view of the threat of the Delta variant transmission, which now serves as the latest set of standards that must be observed in workplace settings, whether in offices or activity venues or service vehicles. These are the issuances on vaccination. DTFC Memo number 372, Guidance on COVID-19 Vaccination for DepEd Teaching and Non-Teaching Personnel. DepEd Memo number 28, Comprehensive Guidance on the Participation of the Department of Education in the implementation of the Philippine National Deployment and Vaccination Plan for COVID-19 vaccines. DTFC Memo number 421, Master Listing of DepEd Personnel for COVID-19 Vaccination. 435, Collaboration and Implementation Guidelines on Back-to-School Campaign Strategies for School Health and Nutrition Personnel and Information Officers. And then number 441, Instructions to the Field regarding the operationalization of DM28 series of 2021, particularly on the vaccination of DepEd teaching and non-teaching personnel. And we also have OUA Memo number 0007210093, mass dissemination of information on self-reporting for COVID-19 vaccination tracker. Now, for the program implementation, regular coordination meetings with NVOC on how to effectively support DepEd in the vaccination of personnel, ongoing coordination of regional division health personnel with their respective LGUs for institutional arrangements on the vaccination of their respective personnel, and then engagement of field health personnel and information officers in the Back to School campaign. So we have planning, national, regional division webinars and town halls to promote demand generation and creating promotional videos to support demand generation initiatives. So we also have regular reporting by the COVID-19 focal persons on the status of vaccination of the personnel in their respective jurisdictions. There's also the collection of data through self-reporting via the COVID-19 vaccination tracker through the mobile app, and then regular release of vaccination data through the DTFC aid memo. For the ways forward, we will sustain the activities of the One Health Week through the school year, contextualizing the implementation in the new normal setup, positioning the programs as essential component of the ongoing preparations for the possible resumption of face-to-face classes in pilot sites, ensuring safe return to schools, continued provision of resource and technical support to program coordinators, and implementation of the joint agreement with DOH and other agencies on schools. And we hope to further strengthen our offline kalusugan sa DepEd.
Maraming salamat po, Dr. Dumlao. With your leadership, patuloy pa rin ang pagbibigay natin ng maayos na serbisyo para sa quality health and nutrition services ng ating mga mag-aaral na may pandemic pa.
Actually partner, hindi lang po BLSS-SHD ang masigasig sa pagpapalaganap ng kalusugan sa ating kagawaran. Partner, syempre nandito din ang suporta at tulong ng ating mga pinuno na talaga namang dedicated sa trabaho para mas ganahan tayong isakatuparan ng ating adhikain.
And to inspire us further and to fuel up our motivation to deliver our services, tawagin natin ang ating Undersecretary for Administration, Yusek Elaine Del B. Pascua.
Today, we are officially closing One Health Week, our annual celebration of DepEd's School Health and Nutrition Initiatives under the Oplan Kalusugan sa DepEd or OK sa DepEd. For the past week, we have amplified our call for bayanihan para sa kalusugan, OK sa DepEd, sa paaralan at sa tahanan through the various flagship programs under the OK sa DepEd. I know that the past week is the culmination of months of work for many of our school health and nutrition personnel who have engaged in long hours of consultations and preparations for showcasing the 6 main flagship programs of Oplan Kalusugan sa DepEd. Maraming salamat sa inyong patuloy na pagbibigay serbisyo para sa bayan, para sa kabataan. Hindi lamang natin pinapanawagan ang bayanihan para sa kalusugan sa nakalipas na linggo, ay ipinamalas din natin ang mga ito. At hindi lang sa nakalipas na isang linggo, kundi maging sa marami pang mga linggong bago ang One Health Week program, kung saan tayo'y nagtutulungan para mairaos ang mga activity na ating isinet sa bawat programa. Gayon din, ang pagpabayanihang ipinakita natin para sa One Health Week ay patunay ng ating mas malawak na kooperasyon sa isa't isa, week after week, month after month, school year after school year, habang dumadaan sa ating pangangalaga, batch after batch, ang K-12 learners na kalaunay higit pang makapag-ambag sa lipunan sa kanilang pag-graduate mula sa basic education. I'm talking to you, our dear health personnel, and also to you, our teachers, dear teachers, and other non-teaching personnel who have supported us during the One Health Week 2021 and who continue to support us during the rest of the year. I'm also talking to our dear partners from government, from the private sector, from the civil society, from the communities, our parents, all of us who are invested in ensuring only the best for our learners and our youth. This partnership, this bayanihan, not only for One Health Week, but for the rest of the school year. This is the heart of Oplan Kalusugan sa DepEd, especially now that we are a country, we are facing one of the greatest challenges of our time, the COVID-19 pandemic. In the past week, we have seen a glimpse of what is in store for us for the new school year for our school health and nutrition programs. Habang nakikita natin ang mga hindi magagandang posibilidad dahil sa pandemya, nawa ay kapulutan natin ng pag-asa ang mga magaganda namang pangitain na nailahad natin para sa bawat programa. At nawa ang mga hamon ng ating kinakaharap, kasama ng ating mga pangarap, ay parehong mahikayat sa atin na patuloy na makipagbayanihan sa isa't isa. Natatapos ang One Health Week as a celebration, pero nagpapatuloy ang mas marami pang pagkakataon para tayo ay magtulungan sa pagtiyak ng health, ng safety at well-being ng ating mga learners sa bagong school year sa darating na taon o sa darating na linggo. Yes, learning must continue, and this has always been our stand. But the only way learning can continue is by ensuring that our learners are healthy, safe, and well. As we look back on the activities that we launched the past week, let us also look forward to the days ahead of us to further cultivate the seeds that have been sown. Muli, maraming salamat po sa inyong suporta at partisipasyon. Mabuhay po kayong lahat.
Ayan, at maraming salamat po, Yusek Alain Del B. Pascua. Tunay nga partner ng ating Yusek ay isang man of action. Isang malaking virtual applause nga po ulit dyan para sa ating Yusek. At partner ha, agree rin ako kay Yusek na meron talaga tayong naging bayanihan para sa kalusugan, lalo na sa nagdaang araw ng ating One Health Week celebration. At grabe, partner, nakakatuwa kasi ang daming efforts at innovations kahit pa medyo hirap tayo sa panahong ito.
Agree ako dyan, partner. Kaya't halina at balikan natin ang mga naging pangyayari o highlights ng ating One Health Week celebration.
Para sa unang araw po ng ating One Health Week celebration, andito ang medical, dental, and nursing services, including ang school dental healthcare program. Dito po nasaksihan natin ang simultaneous inauguration ng 1,869 CES clinics lang naman, partner, na pinangunahan ng ating mga officials. Siyempre, nandyan po ang ating mga regional directors, school division superintendents, school heads, school health personnel, ang ating mga kaguruan, ICT officers, public information officers, at iba pa pong staff na talaga namang sinuportahan ng mga stakeholders at ating mga partners.
Sa pangalawang araw naman, andyan ang Wash in Schools na i-share ng mga regional offices ang kanilang best practices sa WINS despite the pandemic. Na-witness din natin ang first ever launch ng Seal of Excellence ng WINS.
Natatandaan ko yan, partner. Yung first ever launch ng Seal of Excellence ng WINS, talagang memorable yan. At para naman po sa ikatlong araw ng ating One Health Week celebration, andito po ang school-based feeding program. Sa araw po na iyon ay nagkaroon po tayo ng virtual bread and milk toast na nag-signify ng readiness ng kagawaran to implement the SBFP for the school year amidst the pandemic.
Sa pang-apat na araw naman, andyan ang adolescent reproductive health, na i-highlight ang convergence ng comprehensive sexuality education, adolescent reproductive health education. Nakita din natin ang various service delivery mechanism na pwedeng may offer sa mga schools.
At syempre, partner, para naman sa naging ika-5 araw ng One Health Week celebration, andito ang School Mental Health Program. Dito po, nasaksihan natin ang sharing of school mental health initiatives at ang ceremonial observance ng World Suicide Prevention Day. Dahil dito, nakita po natin ang importance ng ating mental health. Syempre, partner, hindi lang para sa sarili natin, kundi din para po sa ating pamilya at para na rin po sa iba pa po nating mahal sa buhay.
At sa panghuling araw naman, na-showcase ang National Drug Education Program. Naipakita natin na sa gitna ng pandemya ay maipaparating pa rin natin ang mga mahahalagang impormasyon sa substance use prevention. Naipakita din dito ang ilan sa mga schools na aktibong gumagawa pa rin ng mga NDEP-related activities.
Grabe no, Nurse Shai, talagang napakagaling ng ating mga programang ito, no, na despite the challenges that we are facing right now, ay nalalaman natin aktibo pa rin at talagang patuloy ang serbisyo sa atin ng ating mga programs na ito, lalo na sa ating mga learners. And tunay nga po, na kahanga-hanga talaga ang mga efforts ng bawat program coordinators at syempre partner sa lahat ng mga nasa likod ng 6 flagship programs na ito.
Tumpak, partner! Sa bawat program na na-showcase natin this week, ay nakita natin ang overwhelming support ng bawat isa. Mula sa number of views and shares sa ating Facebook Live, hanggang sa number ng Zoom participants, makukonclude natin na this week's celebration is a big success.
Agree ako, partner. Big success. Gusto ko yung dinugtungan mo ng big yung success dahil talagang isang malaking successful event ang One Health Week celebration. At syempre, mga kapatid, para naman po sariwain natin ang mga nagdaang activities na kabilang sa ating One Health Week celebration, patuloy po tayong tumutok sa ating DepEd Philippines Facebook page para mapanood ang video of highlights ng kada programa. And partner, yaman rin lang naman na nabanggit mo na marami talaga tayong viewers na sumusuporta sa ating celebration na kahit hanggang ngayon, kitang-kita mo naman, partner, na bububuhos pa rin. Ituro mo naman sa amin ngayon kung paano gawin ang back to school post.
Oo naman, Miss Chin. Pero syempre, bago yan, as one of your back to school champion, I am reminding and encouraging everyone to get vaccinated. Siyempre, kailangan ang ligtas na bakuna para sa ligtas na pagbabalik eskwela. So ano pang hinihintay nyo? Magpabakuna na. So ganito po ang back to school post, partner. Back to school. Ganun lang po siya, back to school. Okay, sabayan mo ako, partner. Yes, and 3, 2, 1. Back to school. Ayan! Pakita naman ang mga back-to-school post niyo, mga ma'am and sir. You can comment down your pictures na naka-back-to-school post sa ating comment section po.
Ayan, partner, paniguradong magaganda ang mga pictures na ipapakita sa atin ng mga participants na yan. At syempre, partner, lubos-lubusin ko na. Magre-request din ako sa ating mga participants na pa-heart or react naman po sa ating closing program to show your warm support sa buong One Health Week celebration. Ayan, heart, and care, react lang po. Ayan, thank you so much po. At muli, tandaan po natin ang reminder ng ating back to school champion na si Nurse Shai na magpabakuna po tayo laban sa COVID-19 para naman po mas maging ligtas ang pagbabalik eskwela. At para naman po sa pag-acquire ng ating mga Certificate of Participation sa bawat activities ng One Health Week celebration, maaari po itong makuha through PDLMS. Siguraduhin lamang po na mag-login using your PDLMS account at kung wala pa po tayong account, siguraduhin pong mag-create na po tayo para makapag-acquire ng certificates. Bisitahin po ang link na magfa-flash sa inyong screen at sundin lamang po ang mga steps or instructions na nakalagay doon. And para naman po sa iba pa pong mga katanungan or any clarifications po, maaari niyo po kaming i-email sa okd@deped.gov.ph. Yan, mag-flash din sa inyong screen. Makikita niyo po dyan.
Ayan, partner. Nandito na tayo sa pagtatapos ng ating closing program. Pero bago yan, shout out po muna ako sa aking mga kasamahan sa Division of Lanao del Norte. Hi po sa aming SDS, Sir Edelberto Opinaria, ASDS, Ma'am Rosemary Cesar, SGOD Chief, Maria Carmela Ablin, CID Chief, Maria Eva Idon, and the Health and Nutrition Section at ang buong division ng Lanao del Norte. Hi po sa inyong lahat. And again, maraming salamat po sa inyong lahat na naging bahagi ng ating successful na One Health Week 2021 celebration.
At syempre, partner, ako din. Meron kasi nag-request sa akin dito na magpa-shoutout rin eh. Syempre, para sa mga DepEd Central Office family ko, hello po sa inyong lahat. Congratulations po sa isang malaking event na ito na naging successful po talaga. At syempre, nagpapa-shoutout po dyan ang ating mga kaibigan mula sa ating mga teacher broadcasters and back to school champion. Sabihin ko na yung talagang nag-request sa akin, talaga particular ha, si teacher broadcaster DJ po natin at ang ating back to school champion na kasama niyo ma'am na si Nurse Josana. Hello po sa inyo! Ayan, Nurse Shai ha, natapos man ang One Health Week 2021 celebration, magsilbi nawa po itong simula tungo sa pagpapalaganap ng quality and health nutrition programs para sa lahat, lalo na sa ating mga learners. Muli po, ako po si Christine Isabel Buenvenida.
Ako naman po si Nurse Claire Shinami Uyog. Maraming salamat po.
Paalam po at mag-iingat po tayong lahat.